Um, in the last few minutes that we have, we're very, very pleased for a special guest of honor to provide some concluding remarks and opportunities and address opportunities of ways to move forward. Dr. Julie Morita is a pediatrician by training. She previously served as the medical director of the Chicago Public Health Department's immunization program, focusing on partnerships with private groups, and has led the city's planning efforts related to Ebola virus. Following 15 years of service to the Chicago Department of Public Health, Dr. Morita was appointed to commissioner by Mayor Rahm Emanuel in January of this year. As the CDPH medical director for immunization, Dr. Morita fostered partnerships with health systems in the private sector, achieving recognition for both the improvements in and overall coverage rates. In 2009, Dr. Morita led the city's response to the pandemic influenza outbreak, developing a system to distribute more than 1 million doses of vaccines to clinics and residents across the city. Prior to her time with the CDPH, Dr. Morita served as the Epidemic Intelligence Service Officer with the CDC and also worked in private practice. Commissioner, we welcome you and thank you for being here.
Thank you so much. Before I talk, I really wanted to just acknowledge, well, first of all, acknowledge that I stand between you and lunch, so it'll be really brief. But I also wanted to acknowledge all the work of Loyola University School of Law. When I look back at the track record of all the work that you've done in the same time period that we've seen the dramatic reductions in lead poisoning over the past few years, you have been actively involved in promoting and advocating for lead prevention. And so thank you so much for your ongoing work and support of the health department in particular. So thank you very much. I mean, I wasn't here for the bulk of the presentations today, but I did have in advance received the presentations that were given, so I had a chance to review the information. And what's clear to me is that we have acknowledged that there's been huge progress that's been made with lead poisoning prevention. But on the other hand, there is still a lot of room for improvement. And I think my experiences in public health over the past 20 years or so have been that when there is an emergency, whether it's related to influenza pandemics or whether it's related to Ebola, often resources become available. And so unfortunately for Flint, your emergency, I'm hopeful, will actually result with more resources becoming available to help with ongoing efforts to prevent this type of thing from occurring in the future. I think I've seen that both with influenza, I've seen that with Ebola as well, and I'm hopeful that more resources will become available. In the 20 years that I've been at the public health, I have seen our lead prevention program funding decrease both from HUD as well as from CDC, and I know that it's time for actually that funding to actually come back. So it's really great to have all this support and interest in this issue. I think the other area that came up in this presentations today, I think, is something that's very near and dear to our heart in Chicago, in that we just released our Healthy Chicago 2.0 public health plan for the city, and the focus of that plan is really on health equity. So it's addressing health disparities, recognizing that not all communities or not all populations have the same challenges, and then making sure that whatever resources that we have available are really directed to those communities and to those populations that have the greatest need. And so we really are focusing on that. We have outlined in our plan 30 goals, 82 objectives, and 230 strategies. And among them include one goal for creating, maintaining affordable, safe, healthy, accessible, and supportive housing. And one of our objectives actually is to reduce the percentage of lead-poisoned young children living in low-opportunity communities by 10% annually. And so we remain committed to moving forward with our work, and also improving it. I think one of the things that we have really felt when we've looked at our program over the years is that we've been very reactive. We don't do things until we identify children who are lead poisoned, and by that time these children are already poisoned. And so as a result of that, we're doing some new work to actually use data that we have collected over the years to identify residences or homes where children are more likely to be exposed, or people are more likely to be exposed to high lead levels. And so based on that information, we'll then send them notifications to allow us into their homes to actually inspect their homes and try to see if there is lead in the home, so that we can abate it before there is an exposure to a child or to a pregnant woman. And so we are being more proactive in that way. The other thing that we're doing is we're trying to use, because public health resources, whether it's at a federal, state, or local level, are not what they used to be, we have to be more efficient. And so as a result of that, we're partnering within the department itself to make sure that all our women and children's health nurses who do home visitings are actually inspecting homes and looking at homes and talking with families about lead poisoning prevention. So we are trying to be much more proactive than we have been in the past. But again, it's a matter of really using the resources that we have currently until more resources become available. And then I guess another point that someone brought up today, which I think is really relates to us right now, is that we're not counting on federal government funding. I think one of the commitments that we have within our public health plan is really to move forward in partnership with other private sector entities, whether it's paint companies or other businesses within the community, to look at them to see whether or not they're willing to contribute to some of our public health initiatives so that we can actually prevent some of these diseases either in childhood or in adulthood by working together and using resources from those other sources. So again, I can't thank Loyola enough for convening this meeting, for your interest and your concern and your ongoing efforts. But what I'm hopeful is that because of the plan that we've outlined for Chicago and our prioritization of more proactive and less reactive work, that we will be successful in addressing some of these concerns that were raised today. So thank you so much for this opportunity, and thank you for your interest in this important issue.
Thank you, Dr. Morita. Thank you all for being here. In this room are federal, state, and local government representatives, public health, housing, and legal service advocates, researchers, academicians, community members, foundation representatives, and I don't know if there ended up being media or not. What we know is that lead is one of the few causes of social and learning problems that we know how to solve. We each have roles we can play to address this problem, whether through research, litigation, education, advocacy for legislative and policy reform, funding on both the government and philanthropic levels, and partnerships. We hope that today is a new start to a conversation that needs to continue and to discussion. In the meantime, just briefly to point out to you, one, in your packet, we've talked several times about early intervention. In your packet is information about the federally funded Early Intervention Services Program. Please read it, know more about it, ask physicians about it, ask anybody that you're talking to when you want to think about early intervention for children. There's going to be some efforts going on in the city, I think, focused on that. Secondly, Dave Jacobs referred to the National Center on Healthy Housing Coalition and some work being done, and his 3 points that he discussed. Those are all actually at the front desk where you registered. In addition, there's information about a petition to HUD around making housing, subsidized housing, lead safe. You can pick up information about that as well. We hope to keep everybody informed about any efforts underway. And whenever there's a crisis, there's always a response through legislation as well, sometimes positive, sometimes not. But we hope to be able to keep everybody involved whose email addresses we have to let you know what's going on both the local and state and federal levels in response to the lead initiatives, and what you can do related to those efforts. And then also our Health Justice Project at the law school is bringing Bruce Lanphier, also a national expert on lead poisoning prevention and a researcher who's now at the Simon Fraser University in British Columbia, Canada. He's going to be here on April 21st at noon. Again, anybody who's interested in attending, we will send out more information to all of you who we have email addresses. Catherine announced before, and we will do our very best to try to get our presenters involved in helping to answer the questions that didn't have an opportunity to be addressed. Please make sure we have your email address if you want to be able to get notices of those answers. And I think other than that, I want to again thank our co-sponsors, and I think I neglected to include Physicians for Social Responsibility in my first list, and if I did, they are equally involved. And I did, oh, thank you. Okay, then and then also, I think that's it actually in terms of announcements. Thank you all for being here, and thank you to all of our presenters for your participation as well.